start off by saying there isn't really a clear progressive primary healthcare network or SASA position on primary healthcare. As I go along, you'll understand why that is so. Because there are many very important questions that have to be asked about primary healthcare. And many assumptions that we're all making, and it's lots of easy, apparently very easy things that you can see clearly in front of us. But if you think more carefully, you'll see that we need to question the way we talk about things. And we have to undergo a paradigm shifts, as Mike suggested. So all these crucial questions and issues have to be debated. And that debate is one that everybody really has to get involved in if you want to really understand what primary healthcare is about. Can I have the first? Okay, now, it's clear from the discussion we've had that everybody wants primary healthcare. But we have to ask what it is. Peter Reynolds mentioned the Alma Mater Declaration, and that is really what most current thinking about primary healthcare is based on. The problem is that virtually anyone who reads it comes away with a different interpretation of what it actually means. And depending on your own agenda and your own background, you can sort of put any interpretation to it that you like. So, in one way, primary healthcare is first contact care. That's the first contact between people and health services. If you read Alma Mater in a different way, then you'll see that it's a comprehensive national strategy for health. You can also interpret it as a new philosophy of healthcare, the paradigm shift that Michael was talking about. Or it could be a movement for social justice and equity in health. Or, if you want to be more and more radical as you go along, you can interpret it as a transfer of power and control over resources and over health to the poor. Now, many people who talk about primary healthcare use some of these terms quite interchangeably, and you don't know exactly what meaning they're talking about now and what meaning they might be talking about later. And I think this is one of the questions: what is primary healthcare? The second, quite fundamental question is: who is primary healthcare actually for? Is it for the poor only? Is it for the third world? Is it for the third world component of South Africa, as people are quite keen on saying? Is it for just the public sector, or is it for everybody? I think this is another important question that has to be addressed. And I think what we need to understand from these questions is that we in South Africa need to develop our own understanding of primary healthcare, what it is and who it's for. And this isn't just talking, this isn't just a question of talking. What has happened around the world since the Alma Mater Declaration is that there's been varying success. Although many governments have adopted it and they see clearly what primary healthcare is in their interpretation, the success rate is very variable around the world. And I think it's because of these different interpretations that people give to the concept of primary healthcare. Next one, please. Now, for the purposes of this discussion, we would like to distinguish between primary care and primary health care. Now, primary care, good primary care, is a good thing. It means that good, comprehensive, affordable, and efficient health services are available to people, and they're easily accessible to those people wherever they happen to be, whether they're at home or whether they're working. So that I would like to call primary care, and that's really what the health sector has to do. Primary health care is is much wider. It includes primary care, but it's much wider than this. And basically, what it means is that all the levels of the health services, the primary care level, the tertiary care level, have to work together with the other sectors, housing, agriculture, education, and so on, and with the community in a process of healthy development. Other speakers have both spoken about the important links between primary health care and overall development. And this is also stated clearly in the state's health policy, where it says that primary health care is an integral part. I've written it down and I want them to read it. It's an integral part of health services and general social and economic development. That's stated in the state health policy, but I think you have to question underneath what it all means. So, having said that, primary health care is integral to development. That means that our understanding of primary health care is also influenced by how we understand development. And we have to ask what we mean by development, and therefore what we mean by underdevelopment. Now, there are two broad ways of understanding development and underdevelopment. In the one, underdevelopment is seen as a condition where some people, some countries, or some people, say within South Africa, have been left behind. They live in a state of backwardness, and they have to catch up to the developed people. And if that's how you understand underdevelopment and development, that means that primary health care, or that development, is a catching up process, whereby those that have been left behind will catch up and be the same as those that have gone ahead. The third world has to become like the first world. Like the third world component in South Africa has to become like the first world component in South Africa. Just ask yourself if that's possible at all. Can everybody live like the so-called first world people in South Africa? I mean, I don't think it's possible. So I think we can throw out that understanding of underdevelopment and development, and look at it more as underdevelopment as a process, which has been going on for a long time and it's still going on. And it's maintained by inequalities in power, access to power, and access to resources. And then the new buzzword in understanding development is the idea of sustainable development, which brings into development the issue of resources and the environment. And as an illustration of, this is a bit complicated, so I'll go through it slowly. As an illustration of the issue of underdevelopment as a process and the issue of sustainable development, I want to just introduce this kind of class analysis. Can everyone see this? Okay, I'll just go through it slowly. The world, people who use this analysis claim that the world has 5 billion people in it. There are 1 billion over-consumers of resources, of energy, and so on. Okay, I think it's, there are about 3 billion sustainers, and there are about 1 billion marginalized people, marginals. Now, I think we have a similar sort of situation in South Africa, but the numbers might be different. Now, how do you recognize an overconsumer? An overconsumer is a person who generally travels by car or by aeroplane. They live in a home where there's one family. And I think we need to look at ourselves as well here. They generally live in homes where there's one family living in the house. They eat packaged food. Lots of meat, most of their food comes in packets. Most of their drinks come in containers, like tins and bottles. How do you recognize a sustainer? Sustainers travel by bicycle or by public transport. They live in smaller homes often with an extended family, cousins and so on. They eat mainly grains and a little bit of meat. They drink clean water from taps. And they recycle a lot of their wastes. How do you recognize marginals? They travel by foot, they live in shacks or simple shelters. They go hungry, they drink dirty water. And I just want to come about how they use things. Right? The overconsumers use up about 60%, 60 to 70% of the world's resources, the energy, the produce from the land, and the produce from the factories. They waste huge amounts of stuff. They're responsible for 90% of the chemicals that are destroying the ozone layer and for the things that are causing global warming. Sustainers recycle most of these things. They're the people who drive second-hand cars if they do drive cars. They wear comfortable clothes, work clothes. Marginal people don't really waste anything. They only waste they produce their own excreta. Now the middle group, the sustainers, are the targets of the multi-billion dollar advertising industry, trying to persuade them to become overconsumers. Now, who's primary healthcare? Which group here is primary healthcare for? Is it for the overconsumers? Is it for the marginals? Is it for the sustainers? If we're using the idea of catching up as development, can everyone in the world live like Americans, for example? I mean, these are some of the questions we have to look for. I mean, can everyone afford the type of healthcare that is called so-called first world healthcare? Some associations. The overconsumers generally have stable populations. They don't have problem with population growth. They look with horror at the other groups, particularly the marginals, where there's a massive population growth. So every day there are more and more marginal people. And I think that's important. The whole world is shifting to the right on that analysis. Okay, let's have the next one. With this background, the two things that everyone agrees on is that you need to have equitable development, equitable health services, and they need to be sustainable. Now, equity and sustainability, if you look at them together, are quite tricky to put together in one sentence, if you like. Because, as I pointed out, I don't think everyone can live like the first world. So, what do you mean by equity? I think if we want to have equity and sustainability together, there's some very important things we need to do. I think we have to ensure maximal self-sufficiency as a nation and self-reliance. We have to democratize access to power and resources. We have to end the environmental degradation, waste, overconsumption, and we have to deal with the population growth problem. Even all that isn't enough, because these other important issues that come into this equation are the issues which we're going to face soon in this country, the issue of foreign debt and structural adjustment programs that the World Bank and the International Monetary Fund are going to be throwing at us. And then there's a slight problem with democracy, because equity means that you have to, equity and sustainability together means you have to think about equity for the generations that are still to come, our children, our grandchildren. And voters vote for their self-interests today. What they want today is what they're going to vote for. So we need a culture that values the future, and we need to work on developing that kind of culture. And now, I want to get down to a few more concrete things. Everyone also, I don't think there's any agreement amongst all the different people, disagreement, all the different people who talk about primary healthcare that you need community participation. As the
quote at the top there again.
Comes from the state policy that says that leadership from the community must be identified, recognized, and involved. Now, what do we mean by community participation? What do we mean by community? And I think the best definition of community participation that I've seen is that community participation happens when the community participates in activities that they have determined for themselves, not what other people have decided they must participate in, but they have decided themselves that they must participate in. And also there's a very important role here for civil society. Civil society is a kind of network of structures that any community sets up for itself. And I think it's through organized civil society that community participation becomes possible in primary health care. As Neville Alexander has pointed out, the network of grassroots democratic organizations in the townships and the trade unions, they're the ultimate guarantors of democracy, because they are the people who take the issues that are important to those people and mobilize around them. And I want to quote from a situation analysis that was done in the run-up to the PHC SOPH policy conference that was held in December last year. Before that conference, teams of people went to different communities around the country to find out how they experienced the health services. And these are some of the quotes. The people who used the health services experienced many problems. They had to travel long distances, they had to stand in queues for hours, they were often turned away after having traveled those distances. Doctors and nurses looked down on them, often blamed them for being sick, and for other circumstances beyond their control, like they were dirty or they stank or something like that. And the health workers themselves, in lots of these places, were demoralized. They didn't treat each other with respect, and therefore they didn't treat their patients with respect. And this raises the issue of how health workers should show concern for people, their communities, and their families. The issue of concerned health worker practice, which is an important part of primary health care. Concerned health worker practice occurs at many levels. It occurs at the individual level between a health worker and a patient. It occurs at the institutional level between the hospital or the clinic, or whatever the establishment is. And it occurs at the national level where health policy makers must make a policy that reflects this type of concern. And then within the health sector, we expect health workers to show respect for each other. And this particularly concerns labour relations in the health sector. Okay, now, the requirements, what do we need to make sure that primary health care can work in this country? And I think there's some underlying thing. We need a national development strategy, which includes primary health care as part of it. That national development strategy should involve all the sectors, education, agriculture, etc. It's not just a decision that the Minister of Health has to make. I think it's a part of national strategy. Secondly, it's some constitutional issues that have to be built in. The rights of civil society to organize themselves openly, and they should also take responsibilities. We need to get the balance between regional government and central government right in the new constitution, and we need to work out the regions and the districts. Without these things, it will be very difficult to implement primary health care. I just want to finish off by mentioning something about non-governmental organizations and the role they play. In South Africa, most non-governmental organizations in health are small and they work locally. They come from a background of opposition to apartheid, and service in underserved areas. Now, over that time that they've been there, they've kind of evolved from providing services to providing training, to providing networking and linking up, say, academic institutions with the community, different communities with each other, different projects with each other. And they've become agents of change and empowerment within communities. And they've built up an incredible amount of knowledge and experience in the democratic implementation of primary health care. And this is the kind of knowledge and experience that we need to build on. Now, to end off, I just want to mention some problems that we have with the current trends in the health services. Probably the most urgent one is the issue of unilateral restructuring of health services. Now, when we're talking from a primary healthcare perspective, I'm not that concerned with unilateral restructuring in terms of not consulting political organizations. I think we're more concerned here with unilateral structuring and not consulting communities. Because what's happening? What's happening now is that things are changing in the health services and no one understands exactly what's going on. So, for example, people are going to hospitals that are being turned away. They're going to day hospitals and they can't be seen because the project is finished. Sometimes, this actually means that sometimes people get angry with the workers in those places, and this amounts to a serious, urgent crisis, at least in the Western Cape. It might be broader. So that's one issue that we're not happy with. The second one is privatisation, which is carrying on. There's a new type of fragmentation in the health services. It's taking health services that should provide to the people in the country and privatising them. For example, doctors in hospitals are now being pushed to doing some private practice. People used to work entirely for the state before. The next problem that I have, at least with the way the state sees primary health care, is that the main policy direction is towards primary health care, yet it sees primary health care mainly as what I define in this talk as primary care, that first contact. And I think these are just some of the